Some women actually have pelvic organ prolapse, and in the mild cases they don't have any symptoms. So you can have a prolapse and not even know you have a prolapse if it's mild. What's up, beautiful people? Welcome to another exciting episode of New Mom with Dr. O. You already know, as always, and as usual, I'm excited to have you guys right here with me. And today we're going to be discussing another interesting topic, because we always discuss interesting topics on this show and all the other shows. I was going to the comment section of one of the videos and someone asked a question about pelvic organ prolapse, right? They wanted me to talk about like how to manage it and just basically an overview of what it's all about. I know some people will be wondering what is that, while others already know what it is. So for the benefit of that person, I promised I was going to make a video, right, to talk about it. Like, easier making a video than typing to explain, what I mean. And it's easier to misinterpret stuff when you're writing, but when I talk, when you hear me talk and when you can see me, then you can't misinterpret anything, because it's basically clear what I'm saying. Today we're going to be talking about pelvic organ prolapse. I'm going to be talking about what causes it, symptoms if there are any, and how to manage it. Okay, so stay tuned. So what is pelvic organ prolapse? First of all, let's start by talking about the organs, like the organs that you have in your pelvis. So your pelvis is like your lower abdomen, right? And right there you have the bladder. So inside your lower abdomen you have the bladder. You have your womb, that's your uterus. So your bladder is the one that collects urine, right, for you to pee. Then you have your womb. Then you have your rectum. So your rectum is like the lower part of your digestive system. Your digestive system or digestive tract starts from your mouth, it ends at your inner. So that's what helps you to digest food. So basically the rectum is the lower part of your digestive system, and that is also part of the pelvic organs that we have. And then we also have the vagina. Vagina is also one of your pelvic organs, right? Yeah, so it's mainly the rectum, the bladder, and the womb, and all their accessories. So all these organs in your body, right, they are supported by a group of muscles and tissues that we call the pelvic floor muscles. So it's like their organs, and then they have a base where they are sitting on, called the pelvic floor muscles, right? This is what is actually keeping them in position. When we say that there is a prolapse, it means that the organs have actually dropped from their regular position. They've dropped. So for example, if the pelvic floor muscles that are supporting these organs, if they get weak for any reason, right, then they're not able to support these organs properly. And then you can imagine something that's holding something well, right? Let me say a tight cloth or something that you're just using to hold something, and the thing now becomes weak, it will drop, and then the thing, whatever heavy object that is on it, will start dropping along with the cloth. So that's basically what's happening. The pelvic floor muscles are getting weak, so they can't stay firm to hold the organs, and they are weakening, and the organs, the weight of the organs are causing it to go down, right? One of the major causes is childbirth. Yeah, when you are pregnant and you have to give birth to a child vaginally, not through CS but through the vagina, right? So that could sometimes lead to those pelvic floor muscles getting weak because of the trauma of childbirth and all that, right? Especially those that had traumatic childbirth. It doesn't happen to every woman that gives birth vaginally, so don't be scared and say, oh, doctor, who said if you give birth vaginally you have pelvic organ prolapse? No, I didn't say that. So many women have given birth vaginally and they did not have pelvic organ prolapse. I'm one of them. So trust me, there is nothing wrong with giving birth vaginally, right? But yeah, some women, this happens to them when they give birth vaginally. Childbirth is one of the reasons. Another one is aging. So when you are growing old, your muscles are getting weaker, your body is getting weaker, your bones are becoming more brittle and all that. So aging can also lead to the weakening of these muscles that will lead to pelvic organ prolapse. Another factor is being obese. So that's why you need to have a healthy weight and maintain a healthy weight, because if you are overweight or if you are obese, you have the risk of pelvic organ prolapse. That's one of the causes. So now some of you may be wondering, like, okay, how would I know if I have pelvic organ prolapse? Like, I might be sitting here and I might have that and I won't even know, right? Like, how would I know if I have it? So some women actually have pelvic organ prolapse, and in the mild cases they don't have any symptoms. So you can have a prolapse and not even know you have a prolapse if it's mild, right? because you won't have any symptoms. But for some, there are actually symptoms, and one of the symptoms that most women complain about, or most women will say they experience, was that they felt a bulge in their vagina. So they felt a bulge in their private part. So it feels like a bulge, and depending on the severity or how bad the prolapse is, the bulge can get as far back as the entrance of your vagina. So you sometimes just putting your finger there, you can even feel it, right? Some might need to put their fingers high up. Some, it's even bulging out of the vagina, depending on how bad the prolapse is, right? Some other symptoms women might feel include like pelvic pressure. So you feel like there's pressure on your pelvic, or you feel pelvic pain. Sometimes it actually causes pain during sexual intercourse, right? So of course, there are many other things that can cause pain during sexual intercourse. So if you feel pain during sexual intercourse, don't say that you have pelvic organ prolapse. No, there are other things that could cause it, right? But pelvic organ prolapse is one of the things that could cause pain during sexual intercourse. And of course, sometimes you might get leaking, like urinary incontinence. So incontinence means that you can't control your urine, and you're just leaking urine. So basically, you're peeing on yourself, kind of thing, right? That can also happen depending on how bad it is, right? So like I already explained earlier, there are different pelvic organs, right? I mentioned that there's the uterus, there's the rectum, there's the bladder, right? And any of these organs can actually prolapse. So any of these organs can actually drop into the vagina or protrude into the vagina. But the most common one that most women experience is the bladder. The bladder prolapses. So, and this is medically called cystocele, right? When the bladder prolapses into the vaginal wall, it's called a cystocele. If it's the rectum that prolapses, it's called a rectocele. So just in case you hear a doctor talking about, hey, tell them Dr. who told you so. Anyway, then sometimes your uterus could also prolapse into the vaginal wall, and the treatment for all of them, or the management for all of them, varies depending on the organ that is prolapsed and depending on the severity of the prolapse, right? If it's something mild that doesn't have symptoms, of course you don't really have to do anything major, right? But if it's something that is protruding all the way to the entrance of your vagina and even almost coming out, then of course you know you have to do something about it. So your doctor will help you to decide on which treatment is best for you based on your symptoms. So of course, if you have that kind of problem, you need to see a doctor. So a doctor can fully assess you. They'll do a physical examination on you. They will ask you a few questions and then come up with a treatment plan for you. Basically, what are the options for managing this pelvic organ prolapse? We have a variety of options, right? The simplest one is what we call the KEGEL exercises, right? So that's the when you're exercising the pelvic floor muscles to strengthen them. Remember that the problem in the first place is that the pelvic floor muscles, they are weak, right? And they can't support those organs anymore. So you need to strengthen these muscles, right? So it's just basically like the same way when you go to the gym, you're going to the gym to build your muscles, you're going to the gym to strengthen your muscles, right? So it's in the same way you're also strengthening these pelvic floor muscles so that they can help to support the organs appropriately. So KEGEL exercises, you know that when you are peeing, let me just use when you're peeing, for example. When you're peeing, you know, there's like, for example, if you want to control your pee, let's say you don't want too much pee to come out, or you're peeing and you want to stop the pee, yeah, those are the pelvic floor muscles you're controlling. So you release it to be able to pee and you squeeze it back to stop peeing, that kind of thing. It's the same thing for your anus as well. When you want to poo, you can squeeze it to let it poo out, and then you can relax it, right? You can squeeze it and you can relax it. So those are like the KEGEL exercises you are doing, practicing how to squeeze those muscles. Squeeze your rectum, squeeze your anus, squeeze the part that helps you to pee, right? That's doing KEGEL exercises, right? So it's difficult to show you, obviously, but that's the best way I can explain it, right? Learn to squeeze those muscles, the ones that help you to pee and the ones that help you to poo. Just be doing, as I'm sitting down now, I'm even doing it, right? Nobody's even going to know that you're doing those exercises, right? So you can do it as much and as often as you want, and you can do it anywhere and anytime. Just keep doing it. You know, you can make the habit that, okay, every 30 minutes I'm going to do it, or every 1 hour I'm going to do it, or every time I eat lunch I'm going to be doing KEGEL exercises as I'm eating lunch. Trust me, you're not a psycho, but it's something to help you to remember to do. KEGEL exercises are good for many other things, for even people that don't have pelvic organ prolapse, right? You can use it for a variety of other things and all that. And it's also good if you learn how to control it for sexual intercourse. But that's a topic for Pillow Talk. I'm not going to talk about that now, right? Because I know you guys will be interested in that. Look out for Pillow Talk. But anyways, we're talking about pelvic organ prolapse, so focus. Yeah, so KEGEL exercises is one of the ways that we help to manage like mild symptoms, right? And then another thing we have is something called the vaginal pessaries, right? So you insert this thing into the vagina and it helps to support the vagina, like it helps to support the weight of the organs, right? So to hold the organs up. So for example, also if your symptoms are not too serious, you can also use pessaries to support the pelvic floor muscles to hold the organs up, right? So that one is inserted through the vagina. Most times it can come in form of a ring or a donut shaped, usually like it's like silicone material really. So you just insert it inside, and of course your doctor has to do this for you. You can't do this by yourself. They normally get the right size for you, right? So your doctor has to fit it and find the right size for you and then insert it for you. So most women say that helps when they've put it in. It helps, it's not painful, it's not uncomfortable and all that, right? And they're able to go about their lives as usual. However, if your symptoms are really severe, pessaries might not help you. So the last resort would be surgery, and the type of surgery will depend on the type of prolapse, like I said before. So your doctor will help you to decide if you need to go for surgery and what type of surgery, right? You work with your doctor to decide that. Obviously your doctor will not just say, no, you have to go for surgery because I said so. No, you're the patient, so you have a say in your treatment, you have a say in what happens to you, right? So you discuss and collaborate with your doctor and decide on the best form of treatment for you, right? But trust me, I know I said childbirth is one of the causes, but it doesn't happen to everyone who gives birth vaginally. So do not be scared to give birth vaginally. Don't go running to your doctor and start saying, no doctor, you know what, I want to do CS because I don't want to deal with pelvic organ prolapse. So many people have had kids vaginally and nothing happened to them, right? So you don't have to be scared. Remember that childbirth is not the only cause. I mentioned a variety of other causes that happen to people that didn't even give birth before, right? So I mean, there's age, there's the being overweight or being obese. So think about that too, right? Maintain a healthy weight. If for any reason, this should be one of the reasons why you want to maintain a healthy weight, right? Because you don't want to have to deal with that. So I hope I have been able to answer your question. If you enjoyed this video so far, please don't forget to click the like button. It really means a lot to me. When you like the video, it helps YouTube to recommend my videos to other people that might need to see this. And don't forget to subscribe if this is your first time watching this video, because I don't want to believe you've been watching my videos without subscribing. Why would you do that? Okay, so please don't forget to subscribe and share it with someone who you think might need to see this. Remember, being a new mom can be pretty overwhelming, but your kids are totally worth it. See you next week.